Good afternoon, everyone. Thank you for joining us. I am Rachel Warner, the Executive Director of Penn's Leonard Davis Institute of Health Economics. Welcome today to our second in a series called Decoding the Moment. We are living in a time of rapidly changing healthcare policy landscape, and this is a seminar series that's a collaboration between us at LDI and the team at Tradeoffs to try and help understand that changing landscape. Today's conversation will focus on recent cuts to gun violence funding for research that were instituted last month by the Trump administration. Thanks everyone for joining us for that important conversation. And thank you also to the many of you who submitted questions in advance of today's conversation. Just a few logistics before we get started. We have one more planned conversation in the Decoding the Moment series in June, later in June. Stay tuned at the end of today's seminar to hear more information about that. Additionally, we are recording today's conversation and it will be available on LDI's website next week. You can find it under our event archive. With that, I want to welcome my colleague, Dan Gorenstein, who is the founder and executive editor at Tradeoffs. Hey, Dan.
Hey, Rachel, thanks so much. Really appreciate it. We're really glad to have this collaboration with LDI at such an important moment in health policy. As Rachel said, I'm Dan Gorenstein. I'm the founder and executive editor of Tradeoffs. If you're new to Tradeoffs, we're a nonprofit newsroom that covers healthcare's toughest choices. We produce a weekly podcast called Tradeoffs, which you can get wherever you listen to podcasts. We've been closely covering many of the changes to health policy coming out of Washington this year. And one move that I think has gotten a little bit lost in all of the things that are happening are the cuts to violence prevention funding. Nearly 47,000 people died of gun-related injuries in the U.S. in 2023, according to the latest data available from the CDC. Yet in April, the Department of Justice terminated hundreds of grants totaling more than $800 million for things like violence reduction, policing, victim services, and behavioral health treatment. The DOJ said these grants no longer align with administration priorities. An analysis of these cuts done by the nonprofit Council on Criminal Justice found that programs in 48 states and territories have been hit. The biggest reduction there is nearly $170 million coming out of community safety and violence prevention programs. These are programs that often work with people at high risk for committing violence. They offer mediation, job training, or social support to try to interrupt cycles of violence. These cuts have already led some programs to lay staff off, reduce services, or even shut down. Our goal of today's conversation, we want to help you all decode this policy announcement from the Trump administration. We'll break down the types of programs targeted by these cuts, the lessons that we have learned in the field about how to prevent gun violence or minimize or manage it, and what the administration's actions could mean for communities impacted by this uniquely American epidemic. We've asked you for questions on this topic, and about 50 of you have submitted them with your registration. Thank you so much for that, and I think those 50 questions suggest just how much interest and urgency there is. We've included a handful that we will get into over the next 40 minutes. We encourage you to, this is really important what I'm about to say here. We really want you to talk with other attendees in the chat. We know that we've got a lot of expertise on this call, and that we hope that part of what we can do through these events is create a place where you all can connect with each other and learn from each other. To help us dig into this new Trump administration policy, I am joined by Dr. Eleanor Kaufman and Jeremy Biddle, and I'm going to ask them to briefly introduce them and talk a bit about their expertise. But again, just briefly, thanks both of you for being here. It's so exciting to have you.
Thank you so much for having us. I'm going to go ahead and go first. I'm Eleanor Kaufman. I'm an assistant professor of surgery here at Penn in trauma surgery. So a good part of what I do is take care of survivors of firearm violence clinically. I also am a health services researcher focused on injury prevention and recovery from injury and violence. And as I'll talk about during this hour, I am the medical director of our hospital-based violence intervention program here at Penn. Thanks again for having us and for spending time on this essential topic.
Thanks, Ellen. Jeremy?
Good afternoon, everyone. My name is Jeremy Biddle. I wear a few hats. One is that I'm the Director of Violence Reduction Policy and Programs at the UPenn Crime and Justice Policy Lab, which is housed in the Criminology Department. I'm also a special advisor to the Mayor and the Police Commissioner of Baltimore City in terms of homicide and non-fatal shooting reduction, a position which I've held since 2021 now at this point. Prior, used to work with lots of cities across the country, and also have a kind of a background in international development assistance, mostly targeting high violence communities in Central and Latin America.
Thanks,
Pleasure
Jeremy.
to be with everyone.
Thank you. Thanks so much for that. And one thing I really want to highlight to the audience here is that Eleanor and Jeremy both are academics. They know research. They think about research. They can wear that sort of wonky hat, but these are also people who are doing things on the ground. Eleanor in the hospital program, Jeremy working with one of the cities that really is grappling with a lot of gun violence, and it is a true gift for all of us that they are here and they've been willing to agree to spend some time with us. So again, thank you both for being here so much. Before we talk about these cuts, right, I really want to kind of set the table, Eleanor, and I want to start with a question for you. One question that we got from several people in the audience, including Deborah Walter, is what kind of programs actually work to prevent violence? You, in a background call, Eleanor, explained that there are three common themes that we see come up in the research. What are these three common themes?
So I think there's a few different ways to think about how programming and policy can prevent violence, but when we're talking about sort of the most direct type of programming, we're talking about programs in a number of different contexts that one way or another identify people who are at high risk of being involved in violence. And because community violence, community interpersonal violence is what we're talking about here for the most part, because it is so structurally determined, it is concentrated in communities that have been disadvantaged by structural racism and historic disinvestment, right, for decades and in some cases centuries. So therefore, the people who are at risk of being hurt are very close to, and in some cases, the same person as the people who are at risk of causing the same harm, right? The same risk factors apply, although the individuals may differ. So on both sides, the interventions are similar. Identify people who are at elevated risk and provide them the support and opportunity that they need to find a different pathway. So that often involves connection and mentorship with some form of credible messenger, people who have experiences and backgrounds in common with the people that they're working with. It involves case management services of one kind or another, connecting the at-risk individual to the resources that they need, in whether it's social services, whether it's education, employment, training, all sorts of different things. And it involves it involves connecting people to alternative opportunities to stabilize their lives one way or another. And this is the model that we use in our program for survivors of violence. This is the model that our sister program from the Penn Injury Science Center uses in community outreach. There's versions of this model that engage with policing in lots of different ways that Jeremy is an expert on. But I think these are really common elements across the board.
Thanks very much for that, Eleanor. And just very briefly here, just one or two sentences. We, the field, have learned about the effectiveness of, I'm just looking at my notes here, mentorship, case management, and connecting people to other opportunities over what, the last 15, 20, 30 years? How?
Yes, I think we're not really talking today so much about the lack of research and lack of research funding and lack of evidence. We're talking about the evidence that we do have. So I think, yes, I think all those numbers are right. I think the evidence continues to build over time, but some of this evidence certainly goes back as far as the 90s. And as a field, I think we're continuing to try to refine that approach, but these are really common elements that are effective for supporting individuals and through individuals, families, and communities.
well-established practices. Got it. Thank you very much. So that's the research a little bit. Like that's the like tip of the iceberg on the research. Jeremy, I'd really like to help the audience understand the funding landscape. First, what was the source of this grant money? I mean, $800 million is a significant amount of cash.
Very significant, which is why the elimination of it is all the more impactful and devastating. So a lot of it traces back to the Bipartisan Safer Communities Act that was passed in 2022. If you all recall, 2020 saw the largest single-year increase in homicides in this country's history, over 30%, off the charts. So obviously there was interest across the aisles to mobilize and come up with a joint plan to actually do something and kind of promote promising practice and scale solutions. As a result of the Bipartisan Safer Community Act and general appropriations, was kind of braided funding, they created, the Department of Justice created the Community Violence Intervention and Prevention Initiative, which is the funding stream for a lot of the violence intervention work that we're talking about. The act itself authorized $1.4 billion over 5 years. It's a lot of money. And for community violence intervention in particular, the act authorized $250 million over that same 5-year period, 2022 to 2026. And as you mentioned in your opening remarks, 170 million of that 250 million is now slashed and off the table, which is, obviously pretty devastating.
So you talk about, this huge investment, right? Congress comes together, $1.4 billion over a 5-year period. This is a huge investment, a huge investment of resources. And I'd really like to understand, Jeremy, for people like you, and Eleanor, if you end up having a thought on this too, feel free to jump in. But like for people like you, what was kind of like the opportunity that this money represented, right? Like Eleanor had just said a second ago, these practices have been sort of well established. We've been doing many of these things, some of it dating back to the 90s. So where was this $1.5 billion going to go and take us new?
So again, the 1.4 stretches across a wide range of different kinds of prevention activities, from emergency risk protection orders all the way to community violence intervention. Focusing specifically on community violence intervention, or CVI, this represented a real opportunity to take that field and this promising practice to scale. A lot of community violence intervention programs have historically been underfunded, scantily funded, with funding instability. There was definitely a scarce, kind of a mentality of scarcity amongst providers, just because of the really dearth of federal funding and leadership in this issue. So this was a turnaround moment for the field to really invest in scalable and sustainable solutions that offer an alternative to the now outdated paradigm of public safety production, which relied solely on police, prosecutors, and prisons. So this was an investment in a different paradigm and a different way of approaching public safety that, was a huge opportunity for the field.
And I would add, I agree. Huge opportunity to bring proven practices to scale. $250 million for community violence investment is a lot. $250 million, across the country over 5 years is, you could math it out different ways, but it's, not actually anywhere near probably what we need, but it is enough, I think, to push some of these practices from pilots, from experiments, from unstable funding situations, and to really build that momentum. A lot of these programs, kind of like I was talking about, are carried out on the front lines, on the ground, by, like I said, some form of credible messenger. So my team here, they're local Philadelphians with, different experiences and exposure to violence among themselves, among their family, right? This offers the opportunity for sustainable employment for people, not only for their own benefit, because people need sustainable employment, but professionalization and the development of expertise and an expert sustainable workforce for this essential work, which is not something you have when you have organizations that lose funding, lose people every other year. Yeah, go
Excuse me,
ahead.
I apologize. I would just add one bit of color. So you're absolutely right. $250 million over multiple years across the communities in the entire country, not enough to address the issue. However, it was enough to really motivate philanthropic partners, the private sector, and local governments to invest, knowing that there was going to be that kind of cost sharing. So that was really the importance. It was both kind of tangible and substantial, but also symbolic in a sense.
I think a lot of us feel like our train finally was moving and now we've hit a wall.
Right. Well, yeah, right. What I'm hearing, and we're still in history. We've got plenty of time to talk about the wall. But what I'm hearing is that there was this sense of momentum that something could be accomplished, and that it must be so incredibly frustrating for the two of you to know about evidence-based programs that work, that have been proven to work again and again. And this momentum opportunity felt like we can finally begin to take at least some of this to scale. It was a version of that, is what I'm hearing. So, okay. Thank you both for this. And I appreciate the history. And I'm not dwelling on this past to put salt in the wound, but to better help us understand what potentially we are losing. So I appreciate you both taking some time to better define what this moment of 2022 and this infusion of money meant. Jeremy, can you tell us a little bit about who was getting the money, a little bit more about the kinds of programs these grants were funding? And I'm just going to call, like, you guys have both been good so far about avoiding jargon, but try to help, for the people on this call, try to like avoid the jargon when you describe these programs, please.
Absolutely. So Eleanor already referenced some of the kinds of programming. So a lot of it is to CBOs, community-based organizations that do direct service work. It could be hospitals, community-based organizations, but this can include everything from street outreach to violence interruption and mediation to connection with intensive services and life coaching. So pretty wide gamut. So the direct service work, very important. And the lion's share of that was really shouldered by CBOs and nonprofits that really were hit the hardest by this. I think upwards of 90% of the grant cancellations impact nonprofits. It also funds other things that are complementary of the direct service work, like training and technical assistance, expertise that can be kind of brought to bear to help scale and sustain these kinds of services and solutions. There are also academic partners assisting with evaluation and research work, as well as local governments, state and municipal, that were using the money, kind of got the money to pass through to local organizations. So that's pretty much the gamut. A lot of these grant funds were, provided to organizations to help them hire additional personnel, so have a wider reach in terms of, potential clients and referrals, and serving individuals at risk, and also serving more communities. So really, that's kind of what's on the table and what's being lost.
And thank you. And just in terms of, just to try to put as fine a point on it, can you just describe ROCA a little bit down in Baltimore, just so people can really understand like what the day in and day out work of a program like this looks like?
Absolutely. ROCA is a pretty remarkable program that was started in Boston, came to Baltimore, if I recall correctly, in about 2018. And they are very specific in terms of the demographic that they serve. Young men and boys aged 16 to 24 at the highest risk of involvement in violence. A lot of their work is focused on, intensive long-term case management to help break cycles of retaliation and trauma. There are elements of cognitive behavioral intervention. They have a mobile CBI curriculum that they've actually developed, so it's kind of streamlined throughout their programming to help rewire, participants' brains to, kind of think more slowly. And it's a lot of the violence that Eleanor mentioned, this community violence. A lot of it's interpersonal, and a lot of it is kind of in the heat of the moment, right?
Right.
So if you could kind of take
a lot of programming to try to help work on you leveraging what we know about brain science, helping
exactly.
people.
And they've been remarkable in terms of being at the forefront of leveraging brain science research and things of that nature. They also do what they call an after shooting protocol. So we know that people who are shot have a much higher likelihood of re-victimization. So they go to the hospital or they knock on the doors of shooting victims aged 16 to 24 within 24 to 48 hours after the incident itself to try to, again, connect them with these life-changing, life-altering services. The whole idea is to bring them into these services, pull them away from their high-risk groups or social networks, uh, introduce more kind of healthy alternatives, and ultimately really provide people who have not had the means with the means and the opportunities to really be on a more positive life trajectory. And a lot of it is because there's structural barriers, as Eleanor mentioned, to folks that are victims / perpetrators with this gray area to access traditional services. So these services actually definitely meet a big unmet need in terms of a population that has traditionally been hardest to reach, but is at the core of the gun violence epidemic in our communities.
Thanks, Jeremy. Eleanor, you're the medical director of a hospital-based violence intervention program in Philly. Obviously, there's overlap with what Jeremy just described with ROCA. But in your work, you are connecting with gunshot victims. You're trying to prevent the future violence, just like ROCA and many of these other programs. Is there a story from your work with this program that gives the audience a more specific understanding of just what it is you do?
There's tons. But yeah, I can talk about this all day, but I will not. So the way that we identify people who are at high risk is our patients are at 100% risk of experiencing violence because they just did. And we know that after people experience a violent injury, they're at risk for a number of adverse consequences. Many people recover smoothly, but many do not. Risks of PTSD and depression in up to 50% of our patients, which is just like what we see in military veterans. Jeremy mentioned the risk of re-injury, which varies depending on how you measure it, but about a quarter of people will come back with a second violent injury. There's increased risks of criminal justice involvement, of violence perpetration, et cetera, et cetera. And so we try to, similarly to ROCA, capture people quickly. And, so the patient who's coming to mind right now wouldn't have met ROCA criteria because he's a 45-year-old man who was injured quite soon after being released from prison. It's a very high risk time in a person's life and a very high risk population. And when I met him, I was skeptical, honestly, that he would be receptive to our teams. But that's part of the magic of the model, is that our violence recovery specialists were able to connect with him. We're able to get him talking, get him listening, get him open to services. He reached out to his own family and friends who wanted to retaliate, and were able to talk them down. So that's a prevented incident of violence that I believe in, but that you can't measure. You can't measure easily. He was able to work with our program to get connected to one of our employment partners. And this is kind of where I talk about how our service is not independent. It's enmeshed with all the other services that are needed for people who are struggling with poverty, with disenfranchisement. So he was able to work with one of our employment partners to get that job. But it was an outdoor job, actually down at Lincoln Financial Center. And we worked with another one of our partners to get him a new coat because it was the middle of winter. So it's a piece from here, preventing retaliation. It's a piece from here, promoting legitimate employment that's going to satisfy his parole officer, making it feasible for him to do that. Within this case, something as concrete as warm clothing he couldn't afford.
I mean, this is sort of
Tons
why
of examples.
this is sort of why you guys, I was looking at your website this morning in preparation for the call. You talk about wraparound services, and I feel like what you just did is help us give a very vivid example of what the wraparound looks like. What's the part of this man's story, this 45-year-old man's story who just returned from prison? What's the most important? What's the part that touches you most in your heart?
You know, I happen to have the chance to talk to this particular patient myself. I don't always, right? And he is just so obviously, everything is so tenuous. We caught him. He responded. He's got these services, and he told us, I think without this program, I would have been back on the corner. I would have gone back to selling drugs, not because he thought it would be good for him, but because he didn't have options available to him. So that's the thing for me, is how close we are every time to succeeding, how close we are every time to failing, and these little moments that can make a huge difference.
Thanks for sharing that specific story. Really appreciate it, Eleanor. So there is, from this report, and if people are unfamiliar with it, the CCJ report is absolutely worth a read if you're interested in this. And it describes that these programs as having, quote, demonstrated potential for strengthening public safety and conserving taxpayer resources, showing statistically significant reductions in measures of violent crime in cities from Sacramento to Chicago to New York. Several people in our audience, including Tony Keltz, wanted to know about specific programs that have been proven effective at reducing violence. And Jeremy, you and Eleanor, you too, after Jeremy's had a chance, are there specific programs that come to mind that are worth shouting out? Not like, there are lots of programs that are doing great work all around the country. We know that, but it'd be great if you could shout out a couple of programs that are doing great work and have really strong evidence behind them.
Absolutely. That's a great question. So one of the things that's elusive about research for community violence intervention work is that it is not done in it's work that's not done in a clinical setting. So evaluation, rigorous evaluation, the kind that, economists, for example, look for, is very difficult with this kind of programming. So we don't necessarily have a lot of gold standard research, at least if you're looking at, that kind of, methodological rigor with huge administrative data sets. What we've got really are really strong, evaluations that, that have been able to demonstrate, for example, the effectiveness. There are organizations, for example, our sister organization, the University of Chicago Crime Lab, has actually been able to do a number of RCTs of this kind of programming. Everything from Choose to Change, which is implemented by youth advocate programs. It has been demonstrated to show less criminal justice contact and victimization prior to programming. The Ready Chicago program is another intervention that they rigorously evaluated. There are a number of evaluations out there, and actually the last 10 years we've seen a boom in different kinds of analytical work and evaluations regarding this kind of programming. That's kind of pushed it more from kind of dubious promising practice to more really kind of become more of a mainstay of the kind of public safety ecosystem that it is today.
Yeah, and I agree with everything you said, which is always a nice feeling. The evidence in the hospital-based side is not perfect either. There have been a number of randomized controlled trials which are not perfect, but are as close as I think we are going to get to the gold standard for evidence, that do show reductions in recurrent violent injury, substantial reductions. And there's a ton of these programs around the country organized through the Hospital Alliance for Violence Intervention that's worth looking at. Another just name that we haven't mentioned are the Cure Violence family of programs, which is really the violence interruption model. It has something in common with everything we've talked about, but a real focus on sort of just-in-time conflict resolution in communities, with program staff really keeping their ear as close to the ground as possible and working hard to interrupt the next conflict that's going to arise.
And Eleanor, I'm not following. Is this a singular program in one location? Is this a program that exists in multiple locations? Can you just describe this a little bit more, please?
Yes, this is a program that started in Chicago, but has been implemented in many contexts, including at relatively small scale in Philadelphia, in Baltimore, in places across the country, and actually across the world, which with pretty impressive evidence for reduction in violence and homicide.
And when it comes to the hospital-based programs, which hospital-based programs got the best evidence, would you say, in your opinion?
I don't think that there's one. I think that that it's a shared model across the field. So some of one of the early randomized controlled trials was done in Baltimore. Baltimore's done a lot of great work in this. We're not just being biased. One of the earliest programs was actually called the Wraparound Program in California, but it's sort of a national level model, I would say.
And thank
Okay.
you for catching me, because Safe Streets Baltimore, which is modeled after the Cure Violence model, has been rigorously evaluated multiple times by Daniel Webster and his team, that has shown significant reductions in homicides and non-fatal shootings.
Great. Well, Tony, thanks for that question. Thanks for you both naming a number of different programs that have got an impressive amount of research behind the work that they're doing. So it's 12:30. We've got about 12 minutes left, and I really want us to finally turn. I want us to turn to these cuts now, but I think I'm really glad that we spent actually about 25 minutes talking about the field itself and what has been learned, because that is no small feat, and that deserves some more attention, I think. So let's talk cuts, though. Jeremy, people have been, if you're paying attention, there are organizations around the country that are laying people off, they're shutting down. Can you tell us how these cuts are impacting some of the organizations specifically that you are working with?
Absolutely. So I would describe what we're seeing really as a contraction, because, as I mentioned before, it's really, these funding cuts are translating into reductions of street outreach workers, reduction of personnel, reduction of the kind of high needs and high risk communities and individuals that could be served. One case in point, Roca Baltimore, which is a close partner, lost $1 million as part of these funding cuts, and they were forced to cancel open positions as well as do modest layoffs, and they reduced their youth workers for the after shooting protocol from 10 to 7. So they were able to, as a result, their referral capacity is diminished. They're able to serve 380 high-risk clients instead of 440. And that's really that gives you a flavor of kind of what these cuts actually translate into. It's not going to force them to close up shop and, fold entirely, but it's a contraction, and it's a contraction that does limit reach of these important life-saving programs.
Jeremy, I spaced out for a quick second there. Can you, looking at the next question, can you say that number again? It's going from what to what?
So they reduced their youth workers from 10 to 7, and as a result, lost 60 referrals in their capacity. So they were able to serve 60 fewer referrals in the calendar year, from 440 to 380.
And thank you. And so, Eleanor, when you hear about that, when you hear about like 60 fewer people, obviously some people can be like 60 fewer people, like who cares? Like that's nothing, like it's a drop in the bucket. But Eleanor, I'm really curious, given the work that you do with your program in the hospital, how do you hear when you hear the number 60? What do you hear when you hear 60?
Yeah. I think Jeremy's giving us a really concrete example. And I am in clinical medicine, so my point of view is always with the individual. So each of those 60 individuals is a person who's now at higher risk than they otherwise would have been, a violence perpetration, a violent injury, right? It's 60 friend groups and families and community areas that are experiencing that risk along with them. But also, I think it's fair to say Jeremy's point is it's 60 at this one organization, but this is not an isolated phenomenon. If it were one organization that lost a staff member, we'd say, I'm sorry. But this is across the field, across the country. As we mentioned, just when we felt like we were getting to a reasonable scale where we could really be making a difference, that we're pulling back either to or worse than, where we've chronically been of working really hard to try to do the bare minimum.
When I heard the number 60, I thought about the 45-year-old story that you mentioned. And it means there are potentially 60 fewer interactions like that. And you compile that, you multiply that around the country. So one of our audience members, Elizabeth Nolte, wrote in to ask, should we expect, given what we're just talking about here, should we expect these cuts to lead to an increase in gun violence? What's the evidence tell us about that, Eleanor?
Yes, we should. We should. I think lots of us in lots of fields across the country are dealing with a lot of anxiety right now. But we have made we've made progress in this programming, and in part related to this programming and in part because of other social forces, we've seen a decrease in gun violence and homicide over the last few years. I was finishing my trauma surgery fellowship and starting my job as an attending trauma surgeon at the height of the COVID surge in gun violence in Philadelphia and nationally. And I feel like we're about to see the same thing happen again. Maybe not with the same degree of suddenness, but with a lot of the same factors in play. We won't see, and Dan, you and I talked about this earlier, you know, it wouldn't necessarily be sudden, because those 60 people, it's not like they don't get their outreach worker and they get shot tomorrow all at once, right? But they don't get their outreach worker. They don't get connected to the services they need. There's they're all at high risk. Someone's involved in a violent incident next week. We don't register that in statistics necessarily. 2 more people can't get a summer job. They're around the neighborhood. They don't have any income. It's hot. There's conflict. People are out. People are carrying firearms. 2 more people from that missing 60 are shot later on in June, right? It's a slow buildup, but I think we've absolutely, with these cuts, made society more dangerous, and we will see that rise, unfortunately.
Jeremy, anything you want to add to that? And if you don't really, then I'm going to go on, because we just have 3 or 4
very quickly. This is happening, interestingly enough, at a time when homicide numbers, and of course homicides are a proxy for lots of other things, are not as well counted. But we're at a kind of a near record low so far this year, levels that we haven't seen since the 1960s. However, we are on the cusp of the summer, and we know that there's a seasonal spike in homicides and non-fatal shootings. So for these cuts to happen this year, when they happened, is just horrendous timing as well.
We've got 3 more questions I'd really like us to get to, and we've got 5 minutes, so sort of more rapid fire with y'all here. Mo Farrell wrote in to ask if states, local governments, and foundations are able to fill the gap left by federal grants. Jeremy?
In part, that's actually one of the things that I'm going to be looking at and monitoring really closely. How do funders and local governments actually respond and react? I can tell you that in Baltimore, there is complete and utter buy-in into this both-end public safety concept, that intervention is a part of the picture and it's here to stay. And I do know that, you know, we're in the middle of budget season at the local level, and a lot of those gaps are and will be filled. But again, you know, what the appetite is, what the situation is across the country has yet to be seen. I hope that there's no backtracking in terms of the massive amount of, you know, philanthropic and private sector support that we've seen to this work. Again, government kind of takes the lead, and a number of organizations follow that lead. The question is there going to be a retraction based on the government now completely removing itself from the picture? I'll say I certainly hope not.
Right. And when you talk about, you know, it's budget season right now at the local level, I think what you're talking about is, you know, is a local tax added? Is there a new fee administered in a way to make up some of the shortfall here?
Yes, and I should also add, these cuts are happening at the same time that the American Rescue Plan Act funding that has benefited this field, for example, the $750 some odd million that Baltimore City received from ARPA, about 50 million was put towards violence prevention and intervention. That's coming to an end in 2026. So just compound that with these cuts as we're the DOJ cuts, and it is a pretty horrible timing, and it just does really it's just it's concerningly could have an outsized impact.
Communities are going to you're saying communities are going to be forced into making some very, very difficult choices in terms of how they prioritize. Let me go to this next question here. Eleanor, we've had a lot of doctors and nurses on this call right now, which is super cool. Thank you all for being here, including Zvinka Schick, who wants to know what providers can do to help address gun violence or mitigate the impact some of these cuts might have.
I think it's a hard question with no easy answer. I think providers can always work to support our patients better, work to practice better trauma-informed care, which is jargon, but is important jargon that refers to how we can respect people's experiences, where they're coming from, and how it influences what's going on with them now, right? I do think that as healthcare professionals, we build these oftentimes very rapid, but very intimate relationships with our patients. We get to know them quickly. We get to know their stories. We get to know their families. I think the world would be a better place if decision makers heard more from my patients, but there's lots of reasons that doesn't happen. Our patients are busy, or they don't necessarily have the time, the interest, or the bandwidth, or the social capital to be heard. So I think the more that healthcare professionals and providers can help carry those stories of what our patients go through and of what they need to people in positions of power, I think that really is very meaningful. And I'm happy to share resources about how to get involved in that kind of thing anytime.
Well, why don't you, because who knows when people are going to get in touch with you, what's the one resource, or what's a way people can be in touch so you can connect them to that?
I'm certainly happy to share my own contact information. One of the easiest opportunities, at least here, if you're in Philadelphia or Pennsylvania, is Ceasefire Pennsylvania's Healthcare Professionals Coalition, which is designed for exactly this. All of our professional societies should be working on this. Many of them are, but Ceasefire is a good place to start if you're local.
Okay, great. And final question, I'd like one sentence from each of you. Is there any upside to these cuts?
No, no, I don't see any upside. I think cities and communities are going to have to make some hard trade-off decisions. But no, I don't think there's any upside. I think the timing is horrible, and I don't really see any valid rationale. These are proven programs that are now stitched into the public safety paradigm that a lot of communities have supported and will continue to support. And this just throws it into a tailspin.
There's no upside. There's not even a cost upside. These are cost-effective programs, which we haven't even really gotten into. But there are reasons to be hopeful. I've got to leave us with something to say. And you and I talked about this. There has been more focus on this issue over the last several years. There is more professionalization. There is more expertise. There is more commitment from organizations, from institutions, from cities, from states, from philanthropists. There is a deeper bench in the field, a better established model that should make us a little more resilient. There's reason for hope, but there's absolutely no upside.
Okay. Eleanor and Jeremy, I want to thank you both very much for this. I'm going to summarize takeaways. Feel free to stay on, and I hope everybody else stays on for this. These takeaways sometimes I think is really important. Here's what I'll say. The evidence in this space is imperfect, but we have a good sense of what works to reduce violence, identify people at highest risk, provide them with mentorship from someone who's been in their shoes, case management services, and connection to other opportunities, like going from selling drugs on the corner to working in a job at the stadium where the Philadelphia Eagles play. A few years ago, Congress signed off on a large infusion of federal funds that allowed evidence-based programs to start to scale to help fuel a reduction in gun violence. Now the Trump administration has stripped much of that funding, $170 million, which is for some programs to help fewer people, and some have shut down entirely. That will likely lead to more gun violence, especially as we go into the summer months where violence often spikes. Finally, states and philanthropies are trying to step in to fill in some of these states and local governments, I should say, and philanthropies can step in to fill some of these funding gaps, but there are a lot of competing priorities and policymakers are going to have to make some tough choices. With that, if you're interested, I'm going to wrap this up by saying if you're interested in learning more about the policy changes and proposals coming out of Washington, please check out our coverage at tradeoffs.org. The newest episode that we've done this week dives deep into a violence prevention program that Jeremy mentioned, Choose to Change in Chicago. LDI also is putting out some excellent information, leveraging the expertise of folks like Eleanor and Jeremy. You can check them out at ldi.upenn.edu, ldi.upenn.edu. And the next Decoding the Moment will be on Wednesday, June 18th. We will be talking with Rachel Werner, Eric Roberts, and Aditi Vasan about why they estimate the changes to Medicaid and the ACA and the Republican budget will continue to lead to 51,000 preventable deaths each year. Keep your eyes on your inboxes for more information next week. With that said, we thank everybody for joining us. It has been a deep pleasure to talk about something so critical to so many of us. Thank you, everybody. Good night.